Dr. Navus, tell us why this is important, this new system that they're debuting here in Coral Gables.
So this is a great example of how this great collaboration between the City of Coral Gables and the Coral Gables Fire Department with Baptist Health really can align the use of a regular technology like an iPad to facilitate the communication between the truck and the hospital. So with this type of improvement, basically you don't waste time when the patient gets to the hospital. You already had all that information and our teams are already ready to receive the patient and treat this patient as fast as possible through the appropriate therapies.
Tell us why this is important, especially in case of stroke.
So specifically for stroke, every second matters, right? So every time that we can shave off from the whole process and get this patient treated as fast as possible really can potentially be the difference between a good outcome, a patient going back to her normal life, versus a patient potentially being severely disabled forever or even dying from it.
And tell us, the protocol for stroke is just time frame. Tell us a little bit about the time frame in terms of getting the TPA.
Yeah, so so basically when the patient suffers a stroke, there's a lot of different types of stroke. Stroke, talking about ischemic part, one of the things that's very important to get this patient as fast as possible to the hospital. Again, as I mentioned, with stroke, every second matters. So the patient may be getting to the hospital and they will be candidate for a clot buster, IV medication, but sometimes we need more advanced treatments such as catheter-based procedures to unblock vessels that are completely blocked inside the brain. So for all these therapies, really the time frame is extremely important. So just to give you the idea, for every 30 minutes, since the vessel gets occluded in the brain, basically the chance of this patient doing well decreases about 10%. So it's extremely important, extremely time sensitive. So the faster these patients can be treated, the better the chance of this patient having a good result.
And how important is looking at through the iPad, for example, seeing the patient and the symptoms?
Yeah, so that tool is critical because basically with that we can help out the fire rescue truck or the crew that is rescuing the patient, and not only helping them to assessment in their stroke scale or the FAST-TD scale score, which is what we use here, but also receiving a lot of information that we would only receive after this patient got to the hospital, information about time of symptom onset, if the patient is on anticoagulation, if the patient has what kind of deficits the patient has, what kind of medication this patient has. So with all that information ahead of time, you can just bring this patient directly to the CT scanner and start the whole inpatient process and protocol for treatment of that patient.
So this represents being at the
Yeah, this collaboration really represents being the forefront of technology. It's the typical and a great example of how technology associated with great medical care can help to improve stroke patient outcomes here in South Florida. What did I just say? Oh yeah. Yeah, this represents a great example of forefront technology where basically we can associate the best available technology with great medical care that we can provide at Baptist Health Florida, and then, okay. Yeah. So how do we start again? If I get a start?
This represents being at the forefront of technology.
Yeah. So this represents being the forefront of technology. Forefront of technology. See? I did it great first time without thinking about it. So, yeah.
This represents being at the forefront
Yeah.
of technology.
This represents being the forefront of technology, and it's a great example of how technology associated with great medical care that we can provide to patients will help improve outcomes of our stroke patients community.
Good?